Welcome back to 41 Today Lifestyle, everyone. I'm over here with Dr. Kevin from Optim Neurosurgery. We want to talk a little bit about, and I'm never going to get it right, the correct pronunciation for this word is?
Do it. Sacroiliac.
Okay, well that's why I'm a host and you're the professional.
Call it an SI joint from this point forward.
Okay, I'm going to, because everyone at home will go, that Aussie doesn't know what he's saying. Some days I don't.
Sorry.
Okay?
SI.
All right, what's an SI?
A sacroiliac joint, or an SI joint, is the biggest joint in the body, and it's made up of the sacrum, or the tailbone, and the wings of the pelvis, the ilia. Okay?
Oh.
Yeah, think of it as kind of the base of the spine, or the foundation of your entire spinal column.
Okay, and the purpose of that is?
Actually, the sacroiliac joint does not have a purpose other than to aid in childbirth. In men, it has no real function at all. It's kind of like an appendix.
Okay, so why would we be needing to see a neurosurgeon about that part of the body?
It's a fairly common cause of back pain. They say that about 75% of people who've had a spinal fusion and still have back pain is coming from their sacroiliac joints. And about, I'd say on average, 20% of people with back pain don't have back pain. What they have is pain coming from their sacroiliac joint.
Okay, well, how do we know that's the pain? Explain that pain for us.
Sure. It is pain at in the low back.
Yes.
Okay. It tends to be dull and aching rather than sharp and stabbing.
Okay.
It's kind of constant. People will notice it more when they're sitting or going up and down stairs. And occasionally it's associated with pain in the groin and pain that runs down the side of the leg, but usually stops at the knee.
Which would feel like you've got hip pain.
Exactly, or a ruptured disc in your back.
Okay, where do you stand? Would a chiropractor be able to diagnose something like that or help with that?
They can.
Yes.
I think that anyone who has back pain, and even if they think it's sacroiliac pain, the standard in neurosurgery is to exclude other causes. So we get an MRI of the low back to make sure it isn't something masquerading like an SI joint problem.
Okay.
But yes, chiropractors can play a role in treating pain coming from the sacroiliac joint.
Okay, the SJ.
The SI.
SI,
Yes.
That's it. SI, everyone. Google that word. Tell me a little bit about the treatment process. Now, I would assume that it's different treatments for different types of pain in that area?
Right, and also different people, there's never one treatment that's right for everybody, but we typically start with doing a diagnostic injection into the joint. We basically...
What is that?
We put a long-acting, essentially Novocaine, into the joint. And if a person has 5-6 hours of pain relief, that confirms that the pain is coming from their sacroiliac joint.
What does that look like? Is that like a long needle or?
Right, but we give people sedation.
I was going to say.
It's done under an X-ray, so people don't feel anything.
I'm starting to sweat just thinking about it.
No
so
need.
let's explain that to everyone at home.
Yeah.
There really isn't pain with that.
No.
So what would people experience when you have that?
The test injection, what we're looking for is anywhere between 4 and 8 hours of at least 80% pain relief.
Then what?
From there, the options include repeating the injection but putting a long-acting potent steroid into the joint to decrease inflammation and pain.
Okay.
There are physical therapy or chiropractic treatments that can be helpful.
Yeah.
You can try to, through a needle, sort of burn the nerves within the joint, something called radiofrequency ablation. And
I've heard of that.
Okay, and for people who we try all that and it doesn't work, there's a minimally invasive surgical procedure where we make about a 1-inch incision and we actually fuse the joint, stopping the movement of the joint.
Okay, I want to remind everyone at home, because we did touch on this on our last interview, do people need to go and see a local GP before they come and see you with these issues, or they can come directly?
They can come directly unless their insurance mandates a referral from primary care, and that's sometimes the case. But they can call our office and we can help guide them through that, whether they need it or not.
All right.
But no, assuming the insurance company doesn't mandate it, we're happy to just take the phone call from the patient and set up an appointment.
All right, Dr. Kevin is, again, great information. We appreciate you.
Sure.
Thanks for stopping by. If you want to find out more information about Optim Neurosurgery, there it all is up on your screen, everyone. Website, phone number, everything you need. And just remember, if you're feeling a little bit of pain, call your GP or your insurance people to see if you need to see your local GP first, or you can call them directly. That's perfect. Back after this short break, everyone. You're watching 41 Today Lifestyle.